In this video, we're going to talk about how to speak with paediatric patients in our clinical practice, as well as with their families, of course. Why is that so important? Well, for a family, coming to clinic and talking about their child's health can often be quite stressful. It can be really stressful for the parents. And if we can engage them and optimize our conversation with them, it helps them in their decision making and us in making the conversation flow. It can also be really stressful for the children themselves. Coming to hospital can be quite a scary day, and being in a room with an unfamiliar doctor and talking about things they might not like talking about can also be quite stressful. And finally, it can be really stressful for you too. If the child is screaming or unhappy or uncooperative, it makes your clinical consultation more difficult for you and might change how you hold those conversations, how well you listen, and how well your explanations go. So let's look at 4 ways in which you can optimize things to try and make it a little bit better for everyone. Firstly, think about how to optimize your clinic environment. This is probably what many of our clinic rooms look like. And this is quite a scary, clinical, and unfriendly environment for a small child to come into. It doesn't look much like their playroom or their school. There might be a few things you could do to change that. Firstly, see if the hospital or the clinic can provide you with some colourful pieces of furniture, such as a couple of chairs that are small and child size, so that they feel welcome in the room and know that there is a special place for them there. These could be stacked in the corner so that they are not in the way when you're seeing adult patients in your clinic instead. And if there's a table, that creates a separate area for the child for them to quietly sit and colour or read or play with some toys while you talk to the parents. That would be a real benefit. Secondly, think about getting a little box of distractions together, such as we've got here. It's really easy to bring this along to your clinic each time under your arm, and remember to cater for different ages. So that might be a rattle, such as the one on the left here, which is useful for small babies and toddlers when you're trying to get an ultrasound from them or examine them. Or here we've got on the right a set of reading books for different reading ages and a simple bag of building blocks. For older patients, for teenagers, you might want to use something like a Rubik's Cube or some of the fidget toys that are quite popular now that teenagers might find helpful to have in their hands while they're having those conversations with you. It's well known that these bring down their anxiety and might help them to focus better on the conversation that they're having with you. Secondly, think about how you can optimize your engagement with the patient when you actually want to examine or ultrasound them in your clinic. Perhaps get the parent to be involved in introducing the concept of an ultrasound, get the child to hold the ultrasound probe, to put the jelly on for you, maybe scan the parent or the toy first before you scan the child. And of course, having a little bag of stickers is invaluable. It's amazing what a child will agree to for a shiny sticker of a dinosaur or a tractor or a rainbow or unicorn afterwards. And that may well help you to get the ultrasound done. With teenagers, it's a bit different. Think about how to optimize them in the conversation. If you talk just to the parents, you're going to exclude and frustrate the child. You need to have these older children directly engaged in the conversation with you, direct your words and your conversation, your questions to them, and make sure you hear really clearly what it is that they have to say rather than the parents. And actually, the parents will really appreciate you taking time to engage with their child rather than ignore the child in the conversation. You can optimize your explanations too. Think about using visual aids such as these to reinforce your message and make it simpler. Pictures always engage the child in the room and will grab their attention. This is an example of a schematic I use to explain what a lymphatic malformation might look like. And parents find that this simplifies the conversation for them too. These are just some laminated sheets that I bring with me to the clinic. We know that fact sheets are important for our patients. Think about whether you could have paediatric fact sheets too for some of your commoner procedures that you offer, so that there's something for the child to read and understand later at their own level. And finally, think about how to optimize conversations on the ward. Those of you who have seen children in the hospital will know that they very quickly commandeer the space and really personalize it to make it feel more friendly and more like home for them. And this is very much their space and one you need to ask permission to invade. So when you come to the ward to get consent or talk about a procedure or to see a patient afterwards, knock at the door, introduce yourself from the door and ask whether you can come in. And in this environment here, think about kneeling at the side of the bed so that your head is at the same level, your face is at the same level as the child, and you're talking directly to them rather than down at them. Secondly, choose your words carefully. Use the word sample instead of biopsy. Use the word lump instead of tumour or cancer. Much more friendly. You don't know whether the parents or the child have heard the word cancer yet, if this is an oncology situation. And even if they have, it's a really scary word to keep hearing in the early days. You can see here I've also used this as an indication for why I might be putting in a line or doing a biopsy. It's to start treatment rather than to use the word chemotherapy from the early days, while they're still getting used to that as a concept. In many countries and some institutions, there might be different consent forms for children of different ages. And consent forms for children may also include somewhere where the child could sign, or you could just get them to sign alongside their parent's signature. This engages them and gets their buy-in to what you're offering and suggesting. And if you've got a fun glitter pen for them to use, that really helps and makes the whole situation feel a bit more special for them. Drawing a big black arrow on someone's arm or leg pointing towards the bit that hurts can feel quite intimidating and threatening. Think about drawing a smiley face or a flower or a sun on their limb or their area that you're going to treat instead for your site marking to make the whole experience a bit less threatening for them. So in summary, think about how to make the environment in your clinic more familiar for them. Actively think about how to engage parents and children in the conversations, such as with visual aids. Respect a child's space on the ward, and choose your words carefully. Make the consent process as least threatening as you can. And I think if you can bear those 4 things in mind, it will make your paediatric practice less stressful for you and for the child and the family, and hopefully will make your paediatric practice one of the best parts of your clinical week. Thank you.